and symptoms of prostate problems. Prostate problems can cause significant discomfort, making it essential to seek a detailed diagnosis from a urologist. Men, just like women with uterine issues, can face prostate problems, a gland that produces a vital fluid for semen. The location of the prostate means that its problems can cause various discomforts, impacting quality of life. The first signs of problems usually involve changes in the man's urinary pattern, varying depending on the condition, whether benign prostatic hyperplasia, BPH, prostatitis, or prostate cancer. Among the main symptoms of prostate problems are prostate enlargement, pain during urination, pain during ejaculation, difficulty starting urination, and weak urine stream. Additionally, there may be a feeling of a full bladder even after urination, increased urinary frequency during the day and night, urgency to urinate, dribbling after urination, and urinary flow blockage due to prostate enlargement. Prostatitis, one of the conditions affecting the prostate, can cause pain and burning during urination and ejaculation, pain in the pelvis and genitals, lower back pain, and increased urinary frequency. It's also common to experience a feeling of heaviness in the scrotum, cloudy urine, fever and chills, blood in the semen, and urinary blockage. In the case of prostate cancer, it can be asymptomatic in the early stages. However, as the disease progresses, symptoms similar to those of BPH may appear, such as urinary urgency, difficulty starting and finishing urination, weak urine flow, feeling that the bladder is not completely emptied, and blood in the urine or semen. The causes of prostate problems can vary. Benign prostatic hyperplasia, BPH, is generally associated with aging and hormonal changes, with risk factors such as family history, obesity, and sedentary lifestyle. Prostatitis can be caused by bacterial infections or chronic conditions without apparent infection, classified into 4 types: acute bacterial, chronic pelvic pain syndrome, and asymptomatic. Prostate cancer is commonly linked to aging, family history, obesity, and unbalanced diets, with Black men having a higher risk. Identifying and treating prostate problems is crucial, with treatments varying according to the condition. Benign prostatic hyperplasia, BPH, can be treated with lifestyle changes, medications, or surgery. Prostatitis is primarily treated with antibiotics. Prostate cancer may require treatments like prostatectomy, radiotherapy, or hormone therapy, depending on the patient's age, overall health, and tumor aggressiveness. As the years go by, it is common for men to encounter more information about the complications arising from prostate enlargement. But what is the normal prostate volume? This gland, a small structure of the male reproductive system, is located in front of the rectum, below the bladder, and surrounds the urethra, the canal through which urine is expelled from the body. Let's clarify the most common dimensions of this organ according to the age of a healthy individual. The normal prostate volume is composed of 70% glandular tissue and 30% fibromuscular tissue, with 2 growth peaks, the first during puberty, when it reaches a stable size until around 25 years, and then a continuous expansion. In a young adult man, the normal size and volume of the prostate are approximately 15 to 20 cubic centimeters, with 2 centimeters in width, 3 centimeters in height, and 4 centimeters in length, similar to the dimensions of a walnut. The normal volume and weight of a healthy adult prostate range between 20 to 30 grams, with the most common size of the gland being 20 to 25 cubic centimeters. From the age of 40, a prostate considered small is approximately 20 grams, while a large gland can weigh between 50 and 100 grams. Symptoms of benign prostatic hyperplasia usually begin to be noticed around 50 years old, indicating a 4 to 5 times increase from the initial weight during young adulthood. Studies indicate that the normal volume of the prostate at 50 and 60 years increases from 24 grams to 38 grams, with about 50% of men presenting BPH in this age range. Although the normal prostate volume in cm superscript 3 can vary from one individual to another, it is certain that the gland changes over the years. Around the age of 80, the prostate volume can be double the initial weight of about 20 grams in youth, totaling around 40 grams, still within the considered normal limits. To detect an increase in prostate volume, the first step is to conduct a medical evaluation. The most recommended exams include a digital rectal exam, PSA blood test, and prostate ultrasound. If changes are observed in these tests, the doctor may request other exams, such as urinary flow measurement, to investigate more serious prostate problems. It is recommended that these evaluations begin at age 40 and be conducted regularly. The frequency of exams can vary from annual to every 4 years, as determined by the doctor. The most common causes of increased prostate volume include factors such as heredity, sedentary lifestyle, medical conditions like obesity and diabetes, family history, and hormonal changes such as increased estrogen and testosterone. The increase in prostate volume can be influenced by a combination of these factors, making it essential to consult a specialist for an accurate diagnosis and appropriate treatment plan. Even though gland growth happens naturally over the years, some measures can help prevent the condition from becoming significant. Regular physical exercise, a balanced diet, quitting smoking, and reducing alcohol and caffeine intake can help reduce the risk of developing benign prostatic hyperplasia. However, age and genetic factors play an important role in the development of the condition, making it necessary to consult a doctor for personalized advice. Understanding the normal volume and weight of the prostate is essential for maintaining male health. By knowing the ideal dimensions and recommended exams, men can take preventive measures and adequately monitor the gland throughout their lives. Always remember the importance of regular medical consultations and following your doctor's advice to ensure well-being and quality of life. With knowledge and awareness, it is possible to promote better prostate health and a fuller, healthier life. Let's continue with the following question. I've just urinated and still feel the urge, why? Who hasn't experienced this disconcerting sensation that seems to defy the logic of the human body? If you found yourself in this situation, know that you're not alone. The persistence of the urge to urinate after a trip to the bathroom can be a cause for concern for many people, leading to questions about their health and bodily functions. If you want to understand more, in this video, we'll elucidate the possible reasons behind this condition, as well as offer some tips for effectively dealing with such a problem. After all, why do I just urinate and still feel the urge? For those who always report on such circumstances, I've just urinated and still feel the urge, it's worth noting that feeling the need to urinate frequently can be a common occurrence and is generally related to abundant fluid intake throughout the day. However, this repetitive urgency can also signal specific urinary conditions, especially when associated with other symptoms. In general, this problem is also known as vesical tenesmus, which is the persistent sensation that the bladder remains full even after emptying it completely. It's an irritative symptom of the bladder but does not necessarily point to a specific disease. A variety of conditions and changes in the body can trigger this symptom, making a detailed investigation essential to determine the underlying cause and propose appropriate treatment. The most common causes that can trigger a frequent urge to urinate are excessive consumption of fluids, coffee, or alcoholic beverages. When there's high water consumption, it's natural for the body to seek to eliminate the excess through urine due to the increased volume in the organism. This is a common physiological response, which can also be observed after excessive intake of water-rich foods, such as watermelon and oranges. Excessive consumption of coffee and other beverages containing caffeine, such as black tea, chocolate, and mate tea, can also increase urinary frequency since caffeine acts as a natural diuretic. Likewise, alcoholic beverages also have a diuretic effect. The use of certain types of medications to treat heart conditions, such as diuretics like furosemide, hydrochlorothiazide, or spironolactone, can contribute to an increased urge to urinate. In such cases, it's important for the patient to immediately inform their doctor so that the possibility of replacing the medication or adjusting the dose can be evaluated. Urinary tract infection. When there's a frequent need to urinate but in small amounts, it may be a sign of a urinary tract infection, especially if accompanied by other symptoms such as pain or burning during urination. Additionally, if the patient feels pain in the lower abdomen region and has a constant urge to urinate, it's essential to seek a specialist doctor to perform tests that help identify the problem. With an appropriate diagnosis, the patient can receive the most suitable treatment for their case. High blood sugar levels. Uncontrolled diabetes is characterized by high levels of glucose in the bloodstream, which leads the body to try to eliminate this excess through urine. If it's confirmed that vesical tenesmus is caused by diabetes, it's necessary to follow the treatment recommended by the specialist doctor, which may include the use of medications and lifestyle changes. Enlarged prostate. Some prostate problems, such as benign prostatic hyperplasia, also lead to a constant urge to urinate, even after using the bathroom, in men. As the prostate grows, the urethra ends up being pressed and even obstructed, so it's normal for changes in urinary frequency to occur. Enlarged prostate can bring serious disruptions to a man's life. Regular visits to the urologist and undergoing preventive exams prevent the problem from reaching its most critical levels. Overactive bladder. Overactive bladder is a condition responsible for causing the sudden and urgent sensation to urinate, even if the bladder isn't completely full. This situation can be caused by increased activity of the muscle responsible for controlling this organ or be a consequence of changes in the nerve signals between the brain and the bladder. Urethral stricture. This is a problem characterized by a reduction in the internal diameter of the urethra, at one or more points, in the form of a scar that limits the passage of urine. Numerous issues can lead to the emergence of a stricture, as well as previous episodes of urethral infections, pelvic or perineal traumas, surgeries through the urethra with the insertion of a catheter, among other conditions. Bladder stones. These are stones composed of calcium salts that accumulate in the bladder over time. Generally, the stones don't require treatment. However, larger stones can occupy the entire organ space, directly affecting storage functions. These stones can form not only in the bladder but also in other organs, such as the kidneys, and reach the bladder through the ureters. Kidney stones. Symptoms arise due to the displacement of one or more solid masses that form in the kidneys from salts deposited in the urine. This condition is also known as renal lithiasis or kidney stones. In some cases, when the stone remains in the kidneys, the patient remains asymptomatic and may only discover the condition when undergoing imaging tests to diagnose other conditions. When an individual has just urinated and continues to feel the urge, it's extremely important to promptly seek specialized medical assistance, preferably consulting a urologist. This professional is responsible for conducting an accurate evaluation and initiating appropriate treatment before the condition worsens. This symptom, in most cases, is linked to other medical conditions, which can worsen over time, causing more discomfort. In this sense, the specialist may request a series of complementary tests to accurately identify the underlying cause, including uroflowmetry, urodynamic study, imaging exams, urethrocystoscopy, as well as blood and urine analyses. It's important to emphasize that the patient should avoid self-medication and the use of home remedies, as these practices can worsen the clinical condition.